Hello. Hello and very good morning, everyone. It is great honor for me to introduce and welcome our today's chief guest, respected Dr. Bhagwat Karad sir. Dr. Bhagwat Karad sir is here with us. We are overwhelmed by his presence at today's Febcon-2022 National Ayurveda Conference. Respected Dr. Bhagwat Karad sir is an Indian politician serving as the Union Finance Minister of State since July 2021 and is a member of Rajya Sabha from the state of Maharashtra since August 2020. He has also served on the Standing Committee of Petroleum and Natural Gas and Consultative Committee on Power, New and Renewable Energy. He completed his MBBS course from Dr. Babasaheb Ambedkar Marathwada University, Aurangabad in 1977. Thereafter, he completed his post-graduation degree, that is MS General Surgery, from same university in 1981. Post that, he got himself enrolled in Mumbai University to pursue MCH Pediatric Surgery and FCPS General Surgery from CPS College, Mumbai. He is the first pediatric surgeon and the highest qualified one from the Marathwada region of Maharashtra. Dr. Bhagwat Karad sir started as a medical practitioner in 1981 at Khedkar Hospital. Later, he started his own hospital, that is Karad Hospital in Nutan Colony of Kranti Chowk area in Aurangabad in 1990. He is the most qualified member of the serving Union Cabinet and has been medical practitioner for 4 decades. His qualification and achievements are endless. And now I would like to request Dr. Bhagwat Karad sir to say a few words for today's Febcon 2022 National Conference, as we all are eager to get some guidance from you. Over to you, sir.
Of inauguration of National Ayurvedic Conference, the dignitaries on the dais, dignitaries of the dais, and the all doctors and the peoples who love Ayurveda from all over country. First of all, I thanks for inviting me for such a nice conference which will deal with Ayurveda. The Ayurveda is a science which is very important for us because it is the only science started in India long back. It is proud moment to address a gathering of almost 1500 plus doctors. And although I am an allopathic doctor, as already I said, it is a pride for the Indian culture and Indian society for the Ayurveda. Even we doctors in all faculties, we know the Is Srothas, who was an Ayurvedic surgeon. And it is very encouraging to note that the almost 1500 plus doctors all over India are participating in this webinar. Though Ayurveda has principles and systems which have not changed over last 5,000 years, and the same principles hold true in today's era as well. This is the uniqueness about all the Indian sciences. There can be latest ways of implementation of the same principles because of the advancement of the technology. Staying in touch with the recent updates and technologies is a great initiative, and every clinician or academician must take on priority. Such events are a good means of knowledge exchange and technology transfer, propagation of new trends. Such webinars will definitely help to the doctors who are practicing, who are academician in the country, and there will be an exchange of the thoughts during this conference. It is a consistent effort. I think there was some video problem, so there was a gap. Anyway, are you able to listen?
Yes,
Hello.
Yes,
आवाज आ रही क्या?
Yes, sir.
वीडियो दिख रहा है? वीडियो दिख रहा है कि नहीं दिख रहा है?
Yes, sir. All fine.
Staying in touch with the recent updates and technology is a great initiative, and every clinician or academician must take it on priority. Such events are a good means of knowledge exchange and technology transfer. It is a consequent effort of Nanal family successfully organizing national level seminars for propagating the authentic knowledge of Ayurveda to students and practicing doctors. 2022 is their 25th year seminar. This seminar is almost 50,000 students and participants across the country have benefited from such seminars. All medicinal practitioners follow one fundamental objective to cure the disease and to reduce the sufferings and pains. Ayurveda is also a similar science, and which is an ancient science. Ayurveda is also, there is no exception to this objective. Ayurveda is the divine way of life and is medical system which emphasized on the motto, prevention is better than the cure. Ayurveda is the most used health care system in the country, except in urban areas. Yet, in the recent time, Ayurveda is being accorded its due, but too gradually. Vaidya Nanal family is a pride of our country and abroad, and their contribution to Ayurveda domains over past 100 years is remarkable. The journey started with late Purushottam Shastri Nanal, who started in 1950 with his clinic work, and he truly institutionalized Ayurveda in early 1900. But starting Tilak Ayurvedic Mahavidyalaya, Ayurveda Prashala, and Seth Tarachand Ramnath Hospital, his work was carried further by their descendants. Vaidya Vilas Nanal took a lot of efforts and did lot of research work on the revival of cardiac disorders. Thalassemia, in association with the Jan Kalyan Blood Bank, Nanal Trust worked successfully in HIV patients, and results were important. Ayurveda is also important in the tribal regions of the Maharashtra. They conducted training camps for whole practitioners and created manuals for their formal training and lending them. Expand hand with this. It is a privilege for me to officially announce their upcoming intentional event, Augustine 22. It is important in Goa. Now, just although I am a medical practitioner, I know that some Ayurvedic medicines are important. Of kidney stone, then the system tablet which we are using, it was from the Ayurveda. Similarly, in the cases of the jaundice or the liver diseases, there is no liver specifically medicine for the liver diseases, but we allopathic experts were prescribing the Live 52 tablet. It is from the Ayurveda. So Ayurveda is a very important, and recently on this occasion, I congratulate Honorable Prime Minister Narendra Modi ji, who has given very much importance to the Ayurveda and the all ancient medical sciences. He has also decided to start 11 institutes in all over the India, and it will be a parallel to the All India Institute of Medical Sciences, which are started recently in different parts of the states in our country. So, and not only that, there is a separate department. It is a Ayush department started by Honorable PM and the concerned minister who now is Mr. Sonowal, who was a Chief Minister of the Assam. I am sure that with the efforts from the Honorable Prime Minister and the central government, the Ayurveda will become famous all over the world, and it will compared to allopathy. It is a less price to the patient, less expenses will be accorded in the treatment of the patients. So, recently, some Ayurvedic colleges are going to start all over the country. That is, government is going to start, and not only that, the government has decided to give the jobs to the Ayurvedic doctors also, in particularly in the rural health care, in national rural health missions. So on this occasion, I appreciate the efforts taken by the Vaidya Nanal family, and I'm sure that with the such efforts from the Nanal, definitely this will the this outcomes which will come from this seminar will be very important. I congratulate Nanal family for such a nice program. They are conducted all the time since number of years. Anyway, I thanks again for inviting me, and declare this webinar or seminar is inaugurated. And from my side, I give best wishes to the Nanal family, organizers, and all doctors who are attending these webinar virtually. Thank you very much. Dhanyavad.
Thank you so much, sir. We are very happy that today you have given your valuable time for us. As we all know that you are working for 4 decades as a medical practitioner in Aurangabad area. And we are so lucky that the importance you have told about Ayurveda, and also that in future our government is doing a lot for our Ayurveda student also, and for every practitioner who is doing Ayurveda practice. So thank you very much, sir, for your valuable time. We are lucky to have your presence here. We hope you will bless us with your guidance in future as well. Thank you once again, sir. A big thank you. Thank you so much. And to all the delegates, we are soon going to start our first session in just 10 minutes. Thank you.
Good morning, everyone. I would like to introduce our Good morning, everyone. I would now like to introduce our first speaker, Vaidya Nanal ma'am. Ma'am mainly deals in the domain of beauty, cosmetology, and trichology. She has completed her BAMS from Bharati Vidyapeeth Deemed University, Pune, followed by MBA in Ayurved Pharmacy from Tilak Maharashtra Vidyapeeth, and MD in Dravyagun Vignan from Uttarakhand Ayurved Vishwavidyalaya. She has also worked as a project development officer for Ayurmed Biotech Private Limited. She has been actively practicing since 2006 as an independent Ayurvedic physician. She works as a chief physician in different charitable OPDs run by Nanal Foundation in different areas of the city. Under Nanal Foundation, she has conducted many free medical camps for low economy areas and slums for propagation of Ayurveda in society. I would now like ma'am to start her session.
So before going ahead further in detail about Yakrut and the topics further, I would like to tell you that this complete presentation I have tried to compile in such a manner where you would understand that how the basic principles or the basic subjects which are being taught to you in first year are important to understand any topic or any disease in Ayurveda. So keeping that thought process, why Sanskrit language is important and how this plays an important role in understanding the definitions or paribhashas given by our sahityakars, then what basic siddhantas play an important role to understand the functioning or the understand the functioning of the certain organ or how this process is taking place. So to understand the basic concept behind it, you need to understand the siddhants given in there. Then about sharir rachna, sharir kriya, then how doshas play an important role, how they are developed or what functions they do, and how this vitiation of these doshas uh, land up in multiple kind of disorders. Then what are the functions of the dhatu, which all dhatus are involved in a particular disease or to understand that organ. What are the malas which are produced and has to be eliminated, what role they perform in understanding that disorder, and the padartha vigyan. So moving ahead, if you will see that first we will decode the word yakrut in Sanskrit. So many a times a lot of students feel that what is the need and what is the necessity to learn the language, Sanskrit language, and why it plays such an important role. So like any other language, any word which is formed in Sanskrit language tells a story behind that word, how that word is formed, what is the action or what is the function of that word. It comprehenses or it comprises of all the functioning of that word. So with that one word, you can completely understand the complete topic. So if you will see that the name is also that much important, and how that how the vyutpatti or how it is placed in a sentence will describe what functioning that word is, what they want to represent or what functions they are doing in that particular sentences. So if we'll see yakrut, yakrut is divided into two words, ya and krut. So ya, in the literal meaning of ya in Sanskrit language is gatatu. That means it represents motion. So it is a verb which signifies that there is a specific action or the motion is happening, and that motion is happening in a continuous state. And krut means chedan. So Chedan here means that there is breaking down, there is cutting, or there is some conversion which is happening constantly in the process, in that situ, in that place. So the two words collectively, it shows there is a constant motion. It can be from left to right or right to left. So either something is coming from outside to inside, or it is something is being sent from inside to outside. So it is a bilateral movement which is constantly happening, and the various entities are coming within. Something is coming within, it is being processed, it is being modulated, it is being changed from one substance to the another substance, and the new form of this substance is being produced, or it is being sent into the body to do a specific kind of function. So it is really very important to understand that what now with in terms of Yakrut, we'll understand what is coming in, what all things are coming in, how it is being changed, and what new things or new product is being formed and it is sent in the body. So thus, liver is such an instrument of the body which is responsible for continuously accepting various stimuli. Here there can be stimuli from Rakta Dhatu, or from Rasa Dhatu, or from Ahar Ras, and then further it is being converted or it is being modulated in such a form that it can be adopted by the body for the various functioning and for the development of the body. So if we'll see liver, it has a ceaseless activity. That is the hallmark of liver. It is not a voluntary movement, it is an involuntary movement where continuously liver is functioning, and this functioning is happening with the instrument that is called Agni. With the help of this Agni, this functioning is happening and this constant work is going on. So if we'll see, Yakrut is a mool sthan for Raktavaha Srothas. As we can see in Rachna Sharir, it is said, Garbhasya Yakrut Plyano Shonita Jo, means that Yakrut is a Matruj Avya. So the development of liver develops from Rakta Dhatu, and this Rakta Dhatu is specifically in the embryological state is taken from Matruj Bij, from Matruj Rakta Dhatu majorly. So for any embryo to have a healthy Yakrut, or the functioning of the Yakrut depends on the quality of Matruj Bij which is coming to the progeny, and how it is functioning, how well it is functioning. We can totally understand that if the mother is having a healthy Yakrut and the functioning of the liver is perfect, and the Rakta Dhatu Sarata is there, then only you will see a healthy and a well-performing liver. Sa eva Agni Pittantara Gataha. So this Yakrut, which is developed from the Rakta Dhatu of Matruj Bij, it inherently binds the Agni. So the Pitta dosha which is produced in this Yakrut, this Pitta dosha is bounded with the Agni for the function of metabolism in the liver. So the first basic function of liver is to bind this Agni to the Pitta dosha, so that the further metabolic activity of the body can be performed by the Pitta. Then this Pitta, which is being bounded by the Agni, is this Pitta Acham Udiriyate. So this Acha Pitta, this good quality or healthy Pitta or Prakrut Pitta, is produced at the time of Amla Avasthapak. Out of 3 Avasthapak, in Amla Avasthapak, this Prakrut Pitta is being developed in Yakrut. And the last is the Raktamal Pitta is also produced as a byproduct, which is of Malaswarup, which is to be thrown out of the body. And during this synthesis of Rakta Dhatu, this Mal is being produced. And if the quantity of this Rakta Mal Pitta is more, then we definitely land up into some other liver problems, which we'll be talking about it further. Now, how this Rakta Dhatu, how this the formation of Rakta Dhatu in Yakrut. So we see that Rakta Dhatu is produced in Yakrut. So the Ahar Ras, now the Ahar Ras which is coming from the food which we intake. So the first Ahar Ras, this Ahar Ras is accepted by Yakrut, and then in this Yakrut there are different stages of conversion. So the Ranjak Pit, the Jalagni, and the Agni Agni. This helps in conversion of this Ahar Ras into Acha Pitta and Saraktamal. Raktamal. So these three act in different stages of transition. So it is not they are acting in at the same time, at the specific time. At every stage, one of this constituent is working, and it is helping in the conversion of Rasa to Rakta. This transition, these individually process different components during the transition and go on binding different components. So the process is step by step. So it is Ahar Ras, it is converted into something, and then it is converted into something else. And all these three Agnis are working, and then the final byproduct is formed, and this byproduct is then again thrown out in the body to perform various functions. So Achar Harit, he says that this process of transition of Ahar Ras into final Rakta Dhatu is done in 7 stages. And these 7 stages can be characterized with 7 different colors of transition. And then the final color of Rakta Dhatu is achieved, which is fresh red color. So this transition which is happening. So if you remember the Siddhanta, the basic Siddhantas, you have read about Pilupak and Pitterpak. So this kind of transition which is happening on Ahar Ras and which is being converted into Rakta Dhatu is a typical example of Pilupak, in which the conversion is at the molecular level from Rasa to Rakta. This process requires a total time duration of 3015 Kal, that is 5/1/4 day. So it takes this much. After the food is ingested in the body, it is converted into Ahar Ras, and this Ahar Ras, after formation of Rasa Dhatu, and from Rasa Dhatu to convert into Rakta Dhatu, it takes 5/1/4 days in total. So now what happens? This Rakta Dhatu, which is being formed. So this Rakta Dhatu is formed, and along with this, there are some other constituents, body constituents, which are formed, which are useful for processing the other dhatus or other mala in the body. So what all are being formed? First is Rakta Dhatu proper. And this Rakta Dhatu proper is the basic karma of this Rakta Dhatu proper is Jivan Karma Krut. So this provides the process of the continuation, the process of nurturing, the process of regeneration is constantly happening in the body because of this Rakta Dhatu proper. Then the other constituent which is formed is Sukshma Mounds. So this Sukshma Mounds, which is formed during the formation of Rakta Dhatu, this Sukshma Mounds is sent further to Is Srothas for the further processing and for the development of Is Srothas. And then this Dhatu Mal, the Rakta Dhatu Mal, which is being formed with Acha Pitta, with the Prakrit Pitta, is to be thrown out. That is the residue which is being formed. And generally, if this Dhatu Mal Pitta, which is being formed, is not thrown properly out of the body, or it is not processed, and the body doesn't get deprived of it, then you will see that in a lot of liver disorders, when you do liver function test, you find elevated levels of HGPT, SGOT. So there you can correlate these elevated levels with Dhatu Mala Pitta, and you have to understand that this Dhatu Mala Pitta is not being thrown out and the level are increasing constantly. Then Upadhatus which are being formed are Snayu and Sira, that is ligament and tendons. And the most important and the last thing which is formed during this process of transition is the contribution of Oj from Rasatmak Oj to as we see that there are two types of Oj in the body. So Ardhanjali Oj, which is present all over the body. So all the 7 dhatu, they produce this Oj at the end of the process. So this Oj, which is being produced during the formation of Rakta Dhatu, is contributing to that Ardhanjali Oj, which is present all across the body. Now, further we have understood that what all is being produced. So now, as we know that this Rakta Dhatu is produced in liver. So to understand that this natural or this Prakrut Rakta Dhatu, which is being produced, it has some specific qualities. And while treating the patient, if we get to know or if we understand that these qualities are not being maintained, so we have to understand that somewhere during the production of this from rasa to Rakta Dhatu, so there is some problem, and that needs to be taken care of, or that needs to be treated. So the characteristic of this Rakta Dhatu is Drava. Dravada, that is one first gun of Rakta Dhatu, that it is fluid in nature. Then Raga, that it has a bright red color. Then Spanda, it's the constant moving of the blood to the micro tissue level, to the cellular level, is because of this pulsating nature, that is called as Spanda. Then it has a peculiar odor, that is called as Visrata. Then it inherits lightness, that is Laguta. So if there is lot of Samata in the Rakta, this property is in most of the cases it is lost, and due to this this quality, hampered quality of blood, you see there are a lot of occlusions, or there is Sroto Avrod, or there is the nourishment which is to be supplied to the minutest part is not being supplied properly. So there you have to understand these 5 gunas of Rakta that has to be taken care of, and that has to be understood while treating the patient with liver disorders or Rakta disorders. Now, the main characteristic of this Rakta Dhatu is it has the ability to sustaining life process by the continuous supply of prana. So any change or the formation of new cells or to supply nourishment, this supply is constantly happening because of Rakta Dhatu, and the main Vayu which is responsible for the life is prana. So to supply this prana to the minutest cell of the body is the characteristic of this Rakta Dhatu. That is why it is said Yunakti Parineman Nama Prana Shonitam hi Anuvartate. So some authors even say that since it has the if Rakta Dhatu gets dushit, then it has the characteristics of dosha, but it doesn't comply with all the characteristics or criteria that it should be accepted in the category of dosha. That is why Rakta is a dhatu and not a dosha. Now, after understanding the Rakta Dhatu, we have to understand what is Srothas. So Srothas is nothing but it is a system. These are the system of interlinked, highly integrated, specialized hollow space. So any space which is interlinked with other organs or body fluid or other parts, and which is a complex structure, and this structure or this space has the capability to intake or to give out. something is called as Srothas. So these are capable of accepting the nutrients, and along with that, they are capable of converting those nutrients into proper tissue and various byproducts. So this is the function of Srothas. So any hollow structure which is accepting the nutrient and which is converting that nutrient to form a proper tissue and the other byproducts, is called as Srothas. So, and these byproducts, the proper tissue which is formed goes for the formation of other organs or other body parts, and these byproducts which are being produced, when they get liberated or they are just left or thrown out in the circulation, they perform their respective function. And this is, so if we see that if there is a problem with any of the organ, or if there, even for example, for that sake, if we see that there are some organs which secrete certain hormones, so if these hormones are not being secreted properly, or it is not being produced properly, and they cannot perform their proper function, so there somewhere there is a Srothas, and this needs to be catered. So in case of Raktavaha Srothas, if we will see, so Raktavaha means that there is a constant flow. Vaha means Vahan, that there is a movement. So there is a flow of blood along a path or along a channel. And now this flow can be of two types. It can be unidirectional or it can be bidirectional in case of Raktavaha Srothas or any Srothas. So unidirectional would be longitudinal along with the blood vessels, that it is emerging from somewhere and it is going in some particular direction. So it has an end point. Whereas in bidirectional, you can see that it is moving across the membrane. So either it is going from inside to outside, that is, as I spoke earlier, that secretion from a gland. So anything which is being secreted, any hormone, any juices, or any micronutrients which are being secreted from the produced from the gland, and it is thrown into the circulation, that is from inside to outside. So that is also the function of Srothas. Or from outside to inside means the aharas or the nutrients which are coming from, or the different hormones or juices which are being secreted from some other organ, and it is absorbed in the other organ to perform a specific function, that is reabsorption of the substance back into the system to perform other various functions. So these both the functioning is of Srothas. Now going specific to the Yakrut, now we should understand that what are the doshas which are involved, or what are the doshas which are being produced, and what are the functions of all the three doshas with respect to Yakrut. Yakrut is an organ which synthesizes Rakta Dhatu and Pitta dosha. As we have already seen that Rakta Dhatu and Acha Pitta is being produced in Yakrut during the process. So any vitiation, so it is not that Pitta dosha is being produced, so other two doshas are not functioning. Other two doshas are there, but they are at the subtle level. They have their specific functions to perform. And if these functions of the other two doshas are happening in a prakrut way, or when they are in their prakrut avastha, then the complete circle is the complete organ, and the output is prakrut. But if there is any vitiation in these two doshas, you will understand, we will see that how the different diseases or the different avasthas develop, which needs to be treated. So any vitiation in other two doshas is effectively going to hamper the functionalities of the organ. Either the organ itself is damaged, or the function. So it can be both anatomical damage also you can see, or you can see the physiological damage. So both the damages can be seen if there is a vitiation in the other two doshas. And excess of kapha dosha. So now we will see that Pitta dosha is there, it is doing its function. Now this kapha dosha, this, if there's an excessive secretion of this kapha dosha, then what will happen is there will be an obstructive pathology, there will be a Srotra overload, and can also alter the matter and material of the organ as discussed earlier, and can demonstrate. And now this, what you will see is that during this Srota Avrot, this when excessive kapha is being produced in that Srotas, we will see that there's elastography in the liver, or there's a biliary sludge in the liver, or there's a hepatomegaly in the liver. So you can see there are different clinical conditions where you can correlate, and many times we think that how to treat that part. So there you definitely have to think about the kapha dosha, and is there any obstruction that because of that this symptoms are being produced. Now, talking about the abnormality, this abnormality can be of three types: ati, mihin, and mithya yoga. And there is samana vishesh siddhant. So according to samana vishesh siddhant, what we can see that if there is same guna, karma, and of a drav is there, so it will increase it, or and if there is the opposite, it will decrease it. So on the basis of that, ki drav, gun and karma, we can see that if there is a ati yoga, for example, so ati yoga means excessive activity. So here what you will see that because of the ati yoga, it leads to vitiation of vata, and because of this vitiation of vata, you can see that there is a depletion in the tissue, and you will see dhatushay avastha, wasting, shrinkage, and further leading into cirrhotic changes. And you can see that there is a dravata, shay of yakrut at the tissue level. So this anatomical changes which you can see is because of ati yoga of vata. Now heen yoga is totally opposite to it, that where it is not performing up to the mark, how much it is supposed to be produced or how much function it is supposed to do, it is not performing up to mark. There you can understand that this is a slow activity, and it leads to the accumulation or obstruction or occlusion in the Srotas. And this lakshan which you will see is weight gain, fatty infiltration, Rutpit Kamla, and impact on overall metabolic activity and systemic performance. Because since the juices or the pitta which is supposed to be produced, there's an occlusion, so the proper functioning, where in ati yoga you can see there's a anatomical changes, in heen yoga you can see that there's a physiological changes in the functioning of the liver. And mithya yoga is an unexplained condition where it is an erratic condition. It is an unpredictable activity where the doshas might perform or might not perform if they are in not there in their prakrut avastha. So it will lead to the wider range of diseases where you can see that there can be a vata disorder, there can be a accumulation jalodar, halimak, kumbha kamla. So these are the conditions which will arise from mithya yoga. So while treating, you have to categorize your patient according to these ati, heen, and mithya yoga, and you have to categorize them according to the doshas, and then that is the way your line of action for treatment will change. Where it is ati yoga, you have to definitely treat vata. So there snehan chikitsa is more important. Whereas in heen yoga, where it is occlusion, there you have to do Vedan, Chedan, and then you have to take care of kapha dosha, and then the treatment will change. Now going further, after understanding what is the function, what are being produced, and what are the doshas involved, we will now understand one of the diseases of liver, that is Kamla Jaundice, its Ayurvedic aspect. So keeping in mind your ati yoga, heen yoga, and mithya yoga, Kamla can be divided into two parts, that is Bahupitta Kamla and Rutpat Kamla. So Bahupitta Kamla is a stage where there's excessive pitta in the Koshta and Shaka. So the quantity of pitta which is supposed to be produced in the liver is more in the quantity, and it is being flooded into Koshta and Shaka, and that is how you will see the clinical condition of the patient, which will have more dominance of pitta in the symptoms. That is, you will see erectus, that is jaundice or pale color of the patient, then high colored urine and stool. This is to be very well understood, that the excessive pitta is not only being thrown out of the body from urine, but even the color of the stool is also bright yellow in color, and it is more yellowish stool. Along with that, you will see there is a burning sensation, there are skin eruptions and fever in Bahupitta Kamla. Whereas different to that, you will see that in Rutpat Kamla, it is an obstructive type of idiopathy, where the pathway of pitta is being obstructed by vata and kapha. So in this condition, the pitta which is being produced, it is not coming into Shakha and Koshta. It is being accumulated in the C2 itself, where it is being produced. So that is why the first characteristic is, you will see icterus, you will see jaundice in patient, but the clay color stool is present. Whereas in Bahupitta Kamla, the color of the stool is yellowish. So this is first differentiation where you can see that the color of the stool is clay color. So there you can understand, okay, that this is an obstructive kind of pathology, and there you need to do the treatment for kapha. Then there is a lot of itching. Kandu is there. If you'll see, itching is in pitta's condition also, but itching is related to kapha dosh. So itching is there. Whereas in Bahupitta Kamla, you will see a lot of itching might be there, but it will have more of burning sensation, and there will be more of eruption. There will be more of pakavastha. Whereas here you will see dry skin, you will see itchy skin. There will be dull ache in the flank, that is on the sides of the body. And there will be constant feeling of nausea and vomiting. Now the management of Bahupitta Kamla, coming to the treatment part, main treatment should be Pitta Shaman and Virechan. As we can see that there is Bahu Pitta, which is coming in Shakha and Koshta. So this Pitta, which is not a natural Pitta, which is Vikrut Pitta, this has to be thrown out from the body. So Adho Marg is the natural marg for the Pitta to be thrown out. So Shaman and Virechan would be the basic line of treatment. Pitta Shaman in Bahupitta Kamla, regular use of Am Pachan. So in lot of conditions, you can see that it would be a Sam Pitta. So along with Rechan, you have to do Pachan also. Shamsan or Virechan are as per Rugra Koshta and Doshabal. So you have to understand that whether you want to do Mrudu Virechan, you want to give Tikshu Virechan. So the choice of drug for Virechan also will depend on the clinical condition and the kind of patient. So if it is a child, you definitely have to use a Mrudu Virechan. And if you will see, there's Bahu Dosh and Dosh Bal is much more, and you want to give immediate Shaman, there you will have to use a Tikshu Virechan, so that the deficit is being excessive deficit is being thrown out of the body, and then later on you can manage the patient with Shaman Chikitsa. Now, lot of time, lot of practitioners do this mistake that once the Virechan or the Shaman of the Pitta has been done, they leave the patient there only. But one further step has to be taken, that is Rasayan Karma in Bahupitta Kamla. That Rasayan Karma is very, very important because of the Ushna Gun, because of the excessive amount of Agni present there. You need to soothe the internal body tissue. You need to regenerate that tissue. So Rasayan is very, very important. This Rasayan Chikitsa will ensure that there is no recurrence of the disease again, and the liver or the cells of the liver or the tissue is functioning at the optimal level, and liver is functioning properly in a smooth manner, because we do not want that patient after viration, the patient should, you are not doing Rasayan Chikitsa and patient is again landing up into Vata disorders. So some drug of choice in Bahupitta Kamla would be Arogavardhani, Kamduda, Moktik Kamduda, Faltrikadi, Avipattikar Churna, Kutaki, and some other agents. Now, talking about the second type of Kamla, that is Rutpat Kamla, as we have discussed earlier, that it is the obstruction type of disorder, where it is the obstruction is because of Vata and Kapha. So you have to make sure that there is a Bhedan, Chedan. So use of pungent, salty and sour substances to tackle the obstructive pathology, that will help in breaking down it into smaller minute particles, and it will Srothas Shodhan will be done, and the passage will be opened for the Pitta to move. Due to their Ushna Viratva, the occluding Vat and Kapha and is released, the Srota Avrodh is cleared, and this ensures the flow of Pitta to the Kuster. This can be judged by the altered color of stool. As I had said, that you get a specific symptom in Rutpat Kamla, that the clayey stool color is there. So how will you differentiate, or how will you understand that the line of treatment which you have chosen is working properly or not? In that case, you will have to analyze the color of the stool of the patient, and patient will report that initially the color of the stool was clayey or white. Now it is coming back to yellowish or normal texture. Some drug of choices in this Rutpat Kamla would be Trikatu, Vidlavan, lime juice, etc. Now, we have talked about these two clinical conditions. Now here we will talk in specific to Punarnava Mantur, which is a drug of choice in any kind of liver disorders, and which works very well. And the way we are representing Punarnava Mantur, there are other drug of choices also for liver disorders. So any drug can be understood, and it can be classified the way we have done it, and you can understand their working pattern and how and in which condition it can be used. For making you understand, we have taken here the example of Punarnava Mandur. With the help of this drug, we will explain you how it is working in the liver disorders. So some of the major ingredients of Punarnava Mandur are Punarnava, Truvrit, Trikatu, Vidanga, Devadaru, and so on and so forth. So all these herbs are to be used in 1 part each. Then 40 part will be Mandur and 60 part will be Gomothra. If we will see an overall Rasveer Vipak of these drugs, so they are Laghu, they are Ushna, Tikshna, they have Saragun, they have they do Am Pachan, Kapha Pachan, and Sama Pitta Pachan. Now, understanding Mandur, which constitutes the 40% of the drug. So Mandur as a single drug has been described in liver disorders like Halimak Kamla, Kumbha Kamla, and Pliha Udar Rog. So it is not that if you want, you can use single Mandur also, as it is already, it is a drug of choice in all types of liver disorder. But fortifying this Mandur with Gomothra and the other herbs will, it enhances its activity, and the results are faster. So Mandur can even be used as lower in case where you have you see the condition of Kamla where the Rakt is depleted or vitiated. The Mandur works as a Pachan and Rasayan. So in Pandu conditions where the liver is not functioning properly, their individual Mandur can be used to increase the HB levels or increase to improve the Pandu conditions, and it also helps in regeneration and works as a Rasayan. So the Rasvir Vipak and the function of Mandur is, it is Kashaya, Ras, Madhur and Tikta Ras. It has Sheet Veer, Katu Vipak. It has Ruchya Karma, Pachan and Rasayan. Now Gomothra, which is constituting 60% of the formulation. The Gomothra should be of choice of the cow, which is not being reared on hormones and boosters, because the quality or the efficacy of the Gomothra is altered in such conditions. And so the function of Gomothra is, it has shaman action. So it has shaman action on kapha. It drags pitta. Naturally, the natural karma of Gomothra is rechan. So it throws the pitta away from the body through virechan. So it gives it a adogati. It has an anuloman effect on vata. And now, if we'll see how Punarava Mandur is produced, so there is a Bharjan Sanskar which goes on with this Gomothra on a low flame. So this Bharjan Sanskar, this Agni Karma, which is being done on all the particles of each and every herb, along with Mandur and along with Gomothra, it makes it more effective on all the three doshas. And that is why in any of the clinical conditions where you are, if you are not able to diagnose which doshas are involved, there you can use Punarnava Mandur directly without giving a second thought. So Gomutra is Madhur, Katu, Tikta, Shar. It's alkaline in nature. It has Ushna Virya, Katu Vipak, Laghu Ushna Tikshna Saragun. It has a strong smell, and Lavan is a very subtle organoleptic parameter. So it has a slight of Lavan gun in it. Now, how this Punarnava Mandur is made and how it manages in liver disorder, we can see that all these ingredients are cooked on low flame in Gomutra. They inherit qualities from Gomutra and because of the Dravagun media, the qualities of these medicines get released in the media of Gomutra. So Gomutra itself has its certain qualities, and since it is liquid in nature, so all the qualities of the herbs which are being mixed with Gomutra is absorbed into this Gomutra, and then the process of Paka is happening. So these all ultimately combine, and a medicine with altogether a new set of qualities. So when this works in this comes in combination, a dough is formed. This has the combined and synergetic effect of all the herbs and which are being used in the production of this medicine. Further, this dough, when it is to be stored in a ghee smeared earthen vessel, and it is left for a certain period of time. Now this component, this compound is subjected to Kala Sanskar, and because of this Kala Sanskar, there is a maturation in the herb. So it gains some certain qualities or during the that span of time, and it becomes more effective and more productive. So Punarnava Mandur, it is a combination. It is a combination which can be used in Shrotha, where in Pandu Rog you see it can also be used during depleted Rakta Dhatu. It can be used in both Rutpat Kamla and Bahupitta Kamla, and it can be widely it also apart from liver disorders, Punarnava Mandur can be a drug of choice where you see that there is a Avrodhajana Samprapti, specifically because of Ama, Kapha, Vayu, Med and other reasons. So wherever you want to do Chedan, Bhedan, and where you want to have a Rasayan Karma, apart from liver disorders, there you can definitely think of Punarnava Mandur as the drug of choice. So now to compile everything together, the small summary that Punarnava Mandur Due to its composition, it is effective in Kamla and related liver disorders. It works best in the obstructive type, and if compounded with Pandu and anemia. If the cause of our cough precipitating, that if kapha dosh is the reason for any kind of disease, it is more effective in pitta predominance condition, that if there is avrot and pitta is also related to it, so it works very well. It works as a curative or protective as well, that is the rasayan karma. And in later stages, if Punanava Mandur, if you want to enhance the efficacy of Punanava Mandur for Rasayan Karma, it can be definitely used with Dadimadi Grit or any other Grit of choice, which will initiate or help in improving the quality of cells. So thank you, students. This is how we conclude this complete session, where we have talked about how the basic concepts of Ayurveda are very, very important to understand any kind of disease or any kind of organ, how you can correlate with the basic concepts which you are learning in the very, very first year, and how it helps you in doing your practice. Thank you.
Zoom session.
Thank you so much, ma'am, for such an amazing session. It will surely help students to understand basic concepts and Siddhant of Ayurveda. Now we will move towards our next session. I would now like to introduce our right speaker, Dr. Prasad Baude, sir. He did his BMS from Pune University and PhD from Tirak Maharashtra Vidyapit. He also did his BA, MA, MPhil in Sanskrit. He was head of Institute of Research in Ayurvedic Medicine, Gnan Prabodhini, Pune, from 1992 to 2011. He is co-investigator of Ayusoft project and also work as an independent researcher guide to PhD. He is practicing since 1991 and is an honorary consultant at Sanjeevan and Sangamnekar Hospital. He is guest lecturing in many Ayurveda colleges and in Maharashtra and Goa. He is also mentor of National Vaidya Scientist Fellowship Program. He has also worked in many research fields so far. Some of his research works are Anukta Vyadhi Upadesh, Vriksha Ayurved, diagnostic study of patients in chronic renal failure, in cancer and cancer, treatment of Krumi and Amla Pitta. He is associated consultant in Midcon Pune. He awarded with thought-provocative article and research excellence award. So I would now like to request sir to please start his session. Over to you, sir.
We are facing some connection issues to Dr. Bavdekar sir. He's soon going to join with us. Within 3 to 4 minutes, he will be live with us for his